Now, chapter 8 is sort of a shorter chapter. It kind of ties in with chapter 7, where we just talked about the bones, and chapter 8 is going to talk about articulations or joints. So know that articulations and joints are the exact same term. They're just, we just use them. Just want to make sure that you're familiar with both words. Okay, so what are joints? Joints are the functional junctions between bones. Okay, if we did not have joints, we would pretty much be this one huge, a slab of bone, okay, where we wouldn't be able to move. So we need to be able to, bend our elbows, bend our knees, and so on. So these are really what makes us able to utilize our skeletal muscles and to provide movement. It also allows for growth. So remember we talked about how ossification happens in our long bones, and then that there was that epiphyseal cartilage or that growth plate. That growth plate is cartilage between two bones, and we are going to consider that it is considered a joint. So any articulation or any binding, anything that binds two bones together is considered a joint, including the growth plate. Okay, and it also allows for parts of the skeleton to change shape during childbirth. So during delivery, the skull, the different bones of the skull, and now we know that the skull is not just made out of one sheet of bone, it's made out of several bones. So we've got the parietal, the frontal, the occipital, and so on. Now, all of these bones, in order to kind of shrink the size of the head of the baby as it passes through the delivery, the birth canal, these bones are going to overlap on top of each other. Okay, and then when the head comes out, they snap back into place. Okay, and as I said, that the presence of joints helps us respond to the movement of skeletal muscles. If we didn't have joints, we won't be able to move. Now, we've got different kinds of joints depending on the structure and depending on the function. So this is basically, an anatomy and physiology course. So depending on the structure or the anatomy of the joint, we classify joints into fibrous, cartilaginous, or synovial joints. While depending on the function, okay, which is the physiology, how do these joints move? Those are classified into immovable joints. So some joints that do not provide any kind of movement, and we call those synarthrotic. Syn means difficult. Arthrosis means, kind of like the word arthritis, anything that has that term arthro, refers to joint. So these are difficult joints, not in the meaning that they are going to give us a hard time, but in the meaning that they do not provide any movement. Amphiarthrotic joints, these are slightly movable. Okay, so kind of coming from the term, amphibian, kind of a little bit of this and a little bit of that. Okay, so amphiarthrotic movement. While diarthrotic movements, these are the one that provide free mobility, kind of like the hip joint and the shoulder joints, where it gives you a very wide range of movement. So while keeping all of these classifications in mind, again, know that any meeting of two bones together is considered a joint. Okay, so let's go over the different kinds of joints. We'll first talk about these fibrous joints. So fibrous joints are where bones are held together with fibrous tissue. Okay, also known as dense connective tissue. These have lots of collagen fibers, and these are going to be found where bones are in close contact to each other. So for example, let's break down first off the three types of fibrous joints that we have. We have syndesmosis, suture joint, and gomphosis. So syndesmosis is where you've got this sheet of connective tissue in between two bones. And because it's a membrane between two bones, we are going to call it an interosseous membrane. Break down the term again. Inter means in between, osseous means bone. So this interosseous membrane is a membrane between two bones, and these are found between the two bones of the leg, the tibia, and the fibula. Okay, so that is one example of it. There, we can also have interosseous ligaments. Okay, so for example, this interosseous ligament, also known as this specific ligament is called the anterior tibiofibular ligament. So it is a ligament between the tibia and the fibula, and it's found in the front. Okay, hence the name anterior tibiofibular ligament. That is an example of an interosseous ligament. Now, both of these are considered syndesmotic joints. They do allow some mobility. Okay, so if you can imagine your lower limb, between the tibia and fibula, there is very slight movement that occurs down there, okay? So they're not stiff, but at the same time, you cannot really do a 360 with your with the lower part of your legs. Okay, so they allow some kind of flexibility known as the amphiarthrotic joint. Okay, so your example for your syndesmosis, which is where the two bones are connected by dense connective tissue like an interosseous membrane, would be between the tibia and the fibula, and that's an amphiarthrotic joint. Now, the second kind of fibrous joint is a suture joint, and these are between the flat bones of the skull. So, again, between, say, the two parietal bones, for instance, giving you this suture right here, that sagittal suture. Well, there is connective tissue in between these sutures, okay, and that's why it's known as a fibrous joint. But is there any movement at that joint? There is no movement at that joint, okay, so once these joints are ossified after delivery, there is no movement. So these are immovable joints. So function-wise, they are synarthrotic. Okay, structure-wise, it's a suture joint, but function-wise, they allow no movement, so it's a synarthrotic joint. Your third, but not and last kind of fibrous joint is known as a gomphosis. So a gomphosis is basically where you have a cone-shaped bony process found in a socket. Kind of, for example, the tooth in the jawbone. So our jaws have these little depressions, these sockets where our teeth are wedged in, and we can see the tooth from the outside. Okay, so yes, I agree that the tooth is not technically a bone, okay, but there is a joint between the tooth and between our jaws, whether it's the mandible, which is your lower jaw, or the maxilla, and that's your upper jaw. There are ligaments that help keep the tooth in place, and those are known as the periodontal ligaments. And these, again, are not movable, okay? So we do not have the ability to move our teeth unless it's loose, okay? But that's not normal. So the norm is to have these gomphoses that are immovable. Hence, they are known as synarthrotic joints. So common mistake, which I'm still trying to figure out why, is not knowing example for gomphosis. Okay, so gomphosis is technically telling you that it's in the gums, okay? It's kind of in the name. Ignore the misspelling, but it's in the name. So the tooth that is wedged within the gums, okay, within the jaws, that is your gomphosis example. Now, those are your fibrous joints. Okay, so all three of those were fibrous joints. Now we'll go next to our cartilaginous joints. And these connections between the bones are going to be through either hyaline cartilage or fibrocartilage. Okay, so depending on the kind of cartilage there, we classify cartilaginous joints into either a synchondrosis or a symphysis. Synchondrosis, where you have hyaline cartilage uniting bones. Okay, some are temporary, like the epiphyseal plate. So remember we said that the growth plate is an example of a joint because it connects the epiphyses to the diaphyses. That is a temporary joint. It is of the synchondrosis kind because it's made out of hyaline cartilage. And then when it ossifies, it'll convert it into a synostosis, which is basically total ossification of a complete bone. The example of synchondrosis, another one, would be between the manubrium, which is this bone right here in the front of the chest, and the very first rib. Okay, so that joint between the manubrium and the first rib is also another example of synchondrosis. Now for the second kind of cartilaginous joint, which is the symphysis, well, this is made out of fibrocartilage. So while this kind, your synchondrosis, was hyaline cartilage, the symphysis is made out of fibrocartilage. Okay, and this will allow for a limited kind of movement. So these are amphiarthrotic joints. For example, the symphysis pubis, and that is the joint between the two pubic bones right in the middle of the pelvis, in the anterior part of the pelvis. Okay, you might be thinking, well, there's really no movement at that joint, but there actually is, especially during delivery. Okay, so this fibrocartilage pad between the two pubic bones does allow for some movement, especially during pregnancy and delivery. Another example would be the intervertebral discs that kind of act as cushions in between the vertebrae. Okay, so these joints are also, these are fibrocartilaginous pads that would be another example for symphysis joints. Now for synovial joints. Actually, the majority of our joints are synovial, okay, and those are diarthrotic, where you have a wide range of movement. The structure of the synovial joint is a little bit more complicated than the others. Okay, these, you do have, the ends of bones. There is a capsule surrounding, there's a fibrous capsule surrounding the joint. You'll have lots of ligaments. If you remove the capsule and the ligaments, on the inside, there is another membrane, okay, so kind of like another envelope, and that is known as the synovial membrane that secretes synovial fluid. Synovial fluid is if you can kind of compare it to if you've ever prepared Jell-O before it hardens, and where it kind of lubricates the joint, okay, but it's not too thick. Okay, that's, kind of like a nutshell what synovial fluid, or the consistency of synovial fluid, is. So we'll take a look at the general structure of synovial joints. Okay, like as I said, they're more complex. You have the two parts, the bony parts that are going to articulate together. The bones usually are covered with articular cartilage in order to decrease the friction between the bones. And that articular cartilage is also made out of hyaline cartilage. There is the synovial membrane, so that darker blue would be the synovial membrane that would be secreting the synovial fluid that circulates within the joint cavity. You can also see on the outside the ligaments that will be part of the fibrous capsule. Okay, so you see that the joint capsule is made out of the fibrous capsule and your synovial membrane. Now, some joints have what are known as a meniscus, would be one, menisci are plural, and these are extra paddings found within the in the joint cavities. So, and we'll find those in the joints that carry weight. So, for example, the knee joint. Okay, and when we take a look at the knee joint, we are going to be talking about menisci that help in carrying or help in cushioning the bones and, kind of decrease the amount of friction between the bones. Some joints have what are known as a bursa, or bursae would be plural, and a bursa is a cavity full of synovial fluid, kind of found between the bone and between the muscles surrounding that bone in order to, again, decrease friction. So these two, these last two are not found in the image, but in this image right here, but we'll see it in other, in the joints to come. So right here you can see a diagram of the knee joint. Okay, so you've got your parts of the joint would be the distal epiphyses of the femur and the proximal epiphyses of the tibia. You also have the patella or the kneecap, and the patella articulates with the femur. Okay, you see it here articulating with the lower part of the femur. It does not really articulate with the tibia. And there is the fibrous capsule, okay, bunch of ligaments surrounding the joint. And it's lined on the inside with that synovial membrane. And the cavity on the inside is full of synovial fluid. You can also see the articular cartilage covering the bony parts, all of the bony parts that take place in this joint. You can also here see the menisci. So this is one meniscus and there's the other. So again, those are extra paddings in order to help in cushioning, while we move and walk and run and so on. You can also see here a bursa. And so a bursa is synovial membrane extensions of the synovial membrane that are full of synovial fluid. And these again are going to help in reducing the friction between bones and between the overlying muscles. So in the front of the thigh, there is this huge muscle made out of 4 huge heads, and that is known as the quadriceps muscle. It has a very strong tendon. So there is a lot of force and a lot of movement there. So in order to decrease the friction between the femur and the overlying quadriceps, there is this suprapatellar bursa. So it's a bursa above the patella named suprapatellar bursa. There's one in front of the patella known as the prepatellar bursa. Okay, and that is one bursa that is very commonly inflamed. Okay, it is related to the tendon of the quadriceps muscle. And there's another one underneath the patella known as the infrapatellar bursa. Okay. So we kind of talked about what the synovial joint looks like. Now there are 6 kinds of synovial joints. For each one, you obviously want to know the name. You want to know what it looks like and an example for each of these. So the first one is the ball and socket joint. And that kind of like the name, indicates, you have a socket and then a ball that would go in it. For example, the joint in the hip joint, okay? So the head of the femur enters into the socket that known as the acetabulum found in the pelvic bone. It is also known as a spheroidal joint, but by far the more common name is ball and socket. The ball and socket joints have the widest range of motion. So again, your hip joint, shoulder joint, for example, is another great example of ball and socket. It is multi-axial, so you're able to do pretty much movements in any direction, plus rotation, which is kind of like making that circle movement, 360 around with your shoulders. Okay, so again, the examples for that are your hip and shoulders. Okay, the next one is the condylar joint, also known as the ellipsoidal joint, where you have an oval condyle that fits into a cavity that is elliptical. Okay, it allows for back and forth or gliding, side to side movement. Okay, does not allow for rotation. For example, the joint between the metacarpals and the phalanges. So your metacarpals are the bones of the hand, and the phalanges are the bones of the fingers. Now a plane joint where you basically have, or gliding joint, basically have 2 flat surfaces that are gliding on top of each other. Okay, it basically leads for back and forth movement. It does not allow for axial movements, okay? And those are going to be found among your carpal joints, so like in the wrist, okay? And it'll also found in the tarsal joints, which are the joints of the ankle. The fourth kind of synovial joint is a hinge joint. Okay, and that works where you've got that convex surface. So you got the convex and the concave surface kind of hinged into one another, kind of like the hinge of a door, how that works. It usually is a uniaxial plane kind of movement. So for example, the elbow joint, okay? Also the joint between the phalanges. So you're able to kind of roll your fingers in and roll them back out. Okay, so that would be at these hinge joints. Again, for the elbow, you're able to flex the elbow, which is to bend it, and extend it, which is to unbend the joint. That is at the level of a hinge joint. I do understand that there are other movements that we could, do at the elbow joint, but those occur at a different set of joints. Okay, so our elbow is a little bit more complicated. It has two different joints going on. One of them is the hinge joint, and that's where we are able to flex and extend our elbows. The other one we'll get to in a minute. A pivot joint, also known as a trochoid joint, and that's basically where you have an axis and you're able to rotate something around that axis. Okay, it allows for rotational movement only. And an example of that is the joint between your first cervical vertebra, known as the atlas, and the dents of the second vertebra, known as the axis. So the C1 and C2, which are the first and second cervical vertebrae, they articulate together where we are able to do a nodding movement. So, twisting the head right and left to kind of say no, okay, that is the rotational movement done at that pivotal joint. Now, a saddle joint, also known as a sellar joint, okay, you'll find that it's between a convex and a concave surfaces. For example, the joint between the carpal and the metacarpals of your thumb. Okay, so the carpal are the smaller bones at the wrist, while the metacarpal is the bone of the hand. Okay, so of the thumb in particular, that is an example of a saddle joint. So for all of these different kinds of joints that we've already talked about, for all of them, you want to know, starting all the way up from fibrous joints, you want to know the name, the structure of the joint, so what is it made out of, what kind of movement is allowed at each joint, if it's in the slide, if it's not, you can move on, and an example for each joint. So what are the kinds of movements that we can provide at these joints? Okay, some of them, as we mentioned, do not provide any movement at all. Some do. And all of the joints are going to, that do move, are going to move because of the action of skeletal muscles. So each muscle has two attachments. One is considered the origin of the muscle or the beginning of the muscle, while the second is considered the end or the insertion of the muscle. Okay, when a muscle contracts, you are going to be pulling the insertion towards the origin. Okay, so again, you've got a beginning to a muscle known as the origin. An end of the muscle is known as the insertion. Okay, the origin is fixed, meaning that when you contract the muscle, you are going to bring the insertion closer to the origin. So I'll try to kind of act that out for you guys, at least, in verbally. So the biceps muscle is the muscle that is found in the front of the arm, and it bends the elbow joint. The origin is somewhere around the shoulder area, while the insertion is distal to the elbow joint. When you contract the biceps, you'll bring the insertion closer to the origin. So when you're bending that elbow joint, you are going to be bringing the insertion closer to the origin. So you bring your forearm closer to the shoulder, okay? You don't bring the shoulder down. You're actually bringing the forearm up. So these are different kinds of movements. Okay, for example, this right here, abduction and adduction. These will be moving away or towards the midline. So if you're bringing the foot towards the midline, that would be adduction. So you're adding the leg inwards. That would be adduction. Abduction would be winging your leg away from the midline. Now flexion and extension. Flexion would be bending. Extension would be unbending. Hyperextension, though, on the other hand, is not a thing that we can do at the level of the knee, but for instance, we can do it at the level of the neck. So you can bend your neck downwards to kind of look at your toes, and then you can flex where you're looking straight forward, and then you can hyperflex your neck where you're looking at the ceiling. Okay, so that is an example of flexion, extension, and hyperextension. Now, lateral flexion is like what this young lady is doing in this image right here, where we're bending away from the midline. We're bending laterally. Now, dorsi and plantar flexion is something that we are able to do at the level of the ankle. Okay, so dorsiflexion would be toward, bending the ankle upwards, while plantar flexion would be bending the ankle downwards, like on standing on your tiptoes. While you would be doing dorsiflexion if you are walking on your heels. Now for medial rotation and lateral rotation, you want to bend the arm, just like this young man right here. Medial rotation would be bringing the arm towards the midline or towards the front of the body, while lateral rotation would be putting it away from the midline. Okay, again, keeping the shoulder constant. You don't want to move the shoulder. You're kind of rotating the shoulder as opposed to extending and flexing the shoulder. Supination and pronation, those are things that we could do at the level, as you can see here, at the level of the arms. Okay, so supination would be where the palms are facing upwards. Pronation would be where the palms are facing downwards. And a good way to remember which one is which, supination would be like as if you're carrying a bowl of soup in your hand, so the palms would be upwards. Pronation would be the opposite. Now for circumduction and rotation, these movements are going to happen at the level of your diarthrotic joints. So the joints that allow for a lot of movement, a very wide range of movement. For example, your shoulder and your hip joints. So circumduction is where you can do a 360 with your shoulder. For example, like this image right here. Or if you're, a tennis player and you're serving, it's your serve. Okay, so, putting your head up, your hand or arm all the way up and then serving that ball, that is, you are performing the action of circumduction. Rotation is, on the other hand, would be a twisting movement. So, for example, if you're doing a screwdriver and you're twisting at the level of your shoulders, that's what a rotational movement would be. Other movements, inversion versus eversion. These are movements performed at the level of the ankle. So inversion would be where the sole looks inwards. Eversion would be where the sole would be directed outwards. Protraction and retraction is a movement at the level of the neck. Also, sometimes we could do it at the level of the mandible or the lower jaw, where protraction would be protruding it anteriorly. Retraction would be bringing it back posteriorly. Elevation and depression are movements of the shoulder. So we can elevate the shoulder, like shrugging our shoulders, and then depression would be putting the shoulders back in their regular positions. Now, since we've got, a couple of important synovial joints, we already know the basics of all of them. Okay, so we know that they're freely mobile joints, wide range of motion. We know what they're made out of, the structure of each of them, or a general idea of them. But there are a couple of, points for each of these important joints to know about. So we'll talk about the shoulder, elbow, hip, and knee joint. For the shoulder joint, it's a ball and socket. Actually, the shoulder joint is one of the very unstable joints of the body. Okay, so the ball and socket is made out of the head of the humerus, and the socket is the glenoid cavity of the scapula. The glenoid cavity is very shallow. It's not a deep socket like in the hip joint. So this shallow socket that has to accommodate this big head of the humerus is what makes the shoulder joint an unstable joint. True that there are strong tendons and muscles surrounding it from all directions to stabilize it, but it is considered one of the less stable joints. Okay, it can be easily dislocated, especially inferiorly. So one of the more common dislocations of the shoulder joint would be downwards, and so towards the armpit. And in the armpit, there are tons of nerves that are running there in order to innervate the muscles of the upper limb. So you can see that a shoulder dislocation, an inferior shoulder dislocation, can injure these nerves down here. Okay. As for the structure, I'm going to leave that up to you guys. So you guys should already know at this point that there is an outer fibrous capsule made out of all of the ligaments surrounding it. So that white capsule that you see on the outside. There's also the synovial membrane that secretes and fills the cavity with synovial fluid. The parts of the joints are covered by articular parts of the bones, that enter into the joints would be covered by hyaline cartilage. And as we age, by the way, that hyaline cartilage tends to disintegrate due to wear and tear, and that's when arthritis starts to kick in. So arthritis is the degeneration of the articular cartilages of our joints. And we can see here a bursa, which again is technically a little sac of synovial fluid, that oily kind of substance that will decrease friction between the bony parts and the surrounding muscles. Now for the elbow joint. So remember I said that one of them is a hinge joint, but I also said that there are other movements that we can perform at the joint. So the elbow joint is made out of two different joints. A hinge joint, that is between the trochlea of, the trochlea of the humerus and the trochlear notch of the ulna. That's where the flexion and extension occurs. But there's another joint, a plain joint, that happens between the capitulum of the humerus and the head of the radius. Okay, that's where the pronation, supination happens. Okay, for all of these joints, there are several reinforcing ligaments, and I'm not going to have you worry about the names of these ligaments, okay? But you do have to know that all of these synovial joints have strong ligaments surrounding them that are fused into the fibrous capsule. Now for the hip joint, okay, hopefully you guys know by now that it is a ball and socket joint made out of the head of the femur and the acetabulum of the hip joint, the hip bone. The socket in this case is very deep. Okay, so this is a much more stable joint than the shoulder joint was. There are tons of ligaments and tendons making a very strong capsule surrounding it. Okay, and that does allow for a variety of movement, but because the socket is deeper, so on one hand it makes it a more stable joint, but yet on the other hand, it kind of limits the amount of movement if you compare it to your shoulder. So a little bit on clinical stuff. How is it that in some cases, due to severe arthritis or maybe due to injuries, some patients are going to need joint replacements. Okay, it's a very common surgery to have. So we've got these synthetic materials that are used in order to replace joints. Okay, some of them are made out of steel or titanium. We can use those for the larger joints. For smaller joints, we can use things like silicone, and sometimes we can even use ceramic. Okay, the most common joint to be replaced by far is the hip joint. But there are newer ways, newer technologies are being developed. So you can kind of imagine having a steel or titanium joint. You always have to walk around with an ID saying, that mentions that you have these. Because let's say you need to go through security in an airport or, like anywhere pretty much, okay? And no matter how many times you tell them that you have nothing on you, but you actually have that steel joint and there's no way to get rid of it. So unless you have that ID, okay, to get you through that security checkpoint, that could be an issue for patients. Okay, so one of the things that, you want to let your patients know that if they get these, they will be getting an ID and they would have to carry it with them all the time. But there are new technologies coming out. Okay, so we can kind of use we're trying to make the joints closer to our own chemistry. Okay, so we'll kind of use different chemicals, different ingredients to make it as close as possible to our natural bodies. Or at least we could do is coat them with hydroxyapatite, which is very close to our bones. Okay, so our bones are made out of calcium apatite. So this is hydroxyapatite. They're kind of like from the same family. And there's also the use of 3D printing technology in order to print out joints. So that would be pretty cool. Our knee joint, it is the largest and the most complex. It's made out of 3 different bones. So we got the medial and lateral condyles of the distal epiphyses in the femur, the medial and lateral condyles of the proximal end of the tibia, and as I said, the patella that is going to articulate with the femur. Okay, there are tons of ligaments. Again, don't worry about them, or don't worry about the names. Know that they exist. There is the menisci, which are extremely important paddings to provide extra cushioning. And there are lots of bursas that we've already mentioned. These are the names of your major ligaments. Again, they're up there, for your personal interest. The kind of, different kinds of knee joint characteristics. So there's a modified hinge joints between the condyles. The knee joint does allow for obviously flexion and extension. There is some rotation that is allowed that the knee can perform when the knee is a little bit flexed. So when the knee is fully extended, there is no rotation allowed. And there's also that plain joint between the back of the patella and the femur. So common joint disorders that happen are sprains. That is tearing of the connective tissue in the joint, okay, without any bone dislocation. So sometimes, playing soccer or basketball or what have you, and you feel like this overstretch of your joints that did not lead to a dislocation, that would be tearing of the connective tissue. So all of those ligaments and the fibrous capsule and all that, that could be overstretched, leading to some tears, and that is known as a sprain. Bursitis is the inflammation of a bursa, and that is usually due to overuse or stress. So, common reasons for bursitis, especially in the knee joint. For instance, gardening, okay? So sitting there on the knees for a very long period of time can lead to that inflammation. So these are things that you kind of want to keep in mind when we ask our patients, like, what do you do for a living, or what are your hobbies, and so on. We're not really being nosy, okay? It's just that we need to know these things so that we could, let them know, well, if you do a lot of gardening, then you want to maybe get a gardener's, knee pad and so on to kind of protect them before they get these diseases, as opposed to waiting until they do and then treat them. So in medicine, the new trend now is prevention as opposed to treatment. Arthritis, which again is one of a very common joint disease, that is inflammation, swelling, and pain in joints. One of the most common, by far, is wear and tear, okay, due to either aging and now actually it doesn't even have to be aging anymore. So all the typing that we're all doing, pretty much as soon as kids are able to figure out how to use their fingers, okay, they're already typing and using cell phones and so on. So we've seen that arthritis is starting to develop at a very younger age. Okay, that is known as osteoarthritis, where when the inflammation of the joints or that degeneration is due to the overuse and the wear and tear. That's known as osteoarthritis. Okay, as I said, the age is tending to get lower as the years go by, but the common theme is wear and tear. And remember, that is the degeneration of that hyaline cartilage lining the joints. Rheumatoid arthritis, though, on the other hand, is an autoimmune disease. An autoimmune disease, general rule of autoimmune diseases is that it is more common. They are more common in women. And an autoimmune disease means that the immune system does not recognize our own body cells. So what the immune system does, that it thinks that these joints are foreign tissue and starts making antibodies against them. And that those antibodies destroy the joints. Okay, that's what rheumatoid arthritis kind of is like in a nutshell. Lyme arthritis is an actual infection. Okay, so there is an actual germ that causes it, and that germ is passed down through tick bites. Okay, so you can see that arthritis can be due to wear and tear, known as degenerative. It can be due to an autoimmune disease like rheumatoid arthritis or lupus. It can be an infection, so an actual bug that can cause arthritis, for example, Lyme arthritis. So what are the lifespan changes that happen to our joints? Well, one of the early signs to happen would be joint stiffness. Okay, and like I said, arthritis is extremely common, especially with overuse. The ones that tend to change first are the fibrous joints. Okay, cartilage in the synchondrosis starts to stiffen, hence decreasing their ranges of motion. Ligaments lose their elasticity. Okay, the changes, for example, in the symphysis joints of the vertebral column tends to have, where people start shrinking. It decreases their height and flexibility. And it's mostly due to water loss from the intervertebral discs. So it's not a matter of, oh, these people are not drinking enough water. That's just the water loss that happens as a normal aging process, part of the normal aging process. Synovial joints are going to start losing functions because of the diminishing in blood supply. And disuse hamper. Disuse means, no activity or limited activity is going to decrease the amount of blood supply reaching the joints, and that, increases the rates of stiffening and decrease range of motion and so on. So one of the best things that you want to tell your patients would be activity and exercise, okay? Especially for joint movement, best thing would be movement underwater, okay? That strengthens the muscles. It strengthens the range of, or increases, widens the range of motion, okay, while decreasing the pain. Okay, so activity and exercise can definitely keep joints functioning for a longer period of time. So these are the descriptions of the movements. So remember we were talking about abduction and adduction. These are in writing, these descriptions. Okay, so I'll let you guys read that. And that ends this chapter. I will see you in our next chapter.